viewers, welcome to Health Matters with Corporate 24. In today's session of Health Matters, we're going to be discussing prostate cancer. With me, I have got specialist oncologist, Dr. Kudzaima Kowa, and also with my co-presenter, Dr. Chipapa, also from Corporate 24. Welcome, Doc.
Thank you. Thank you very much.
Welcome, Doc. Maybe for this one, you can take it up.
Hello, everyone. Thank you very much, Dr. Kowa, for placing us. I'm sure everyone is aware that last month was Men's Health Month. Okay. So, concerning our topic today, how common is prostate cancer in Zimbabwe?
Thank you very much for inviting me for this program, and it is a huge honor to be discussing prostate cancer, which is the commonest cancer in Zimbabwe. So vachinoita no cancer inobata vana baba zvakanyanyisa. Saka tichitarisa macancer muZimbabwe, or yatinoti the epidemiology of cancers, prostate cancer is the second commonest cancer in Zimbabwe after cervical cancer, accounting for 10% of all cancers. And what's most unfortunate is that most patients present with advanced stage disease. We see about 7,500 cancer patients a year. 20% of those are cervical cancer, and prostate cancer, like I said, is number 2 at 10%.
Thank you very much. Those are very high numbers, if I must say. Maybe if you can just tell us, maybe just to educate us, what are the risk factors with regards to prostate cancer?
Okay, so risk factors can be modifiable or non-modifiable. The non-modifiable risk factors, apana zvatinogona kuita about them. And for prostate cancer, advancing age is perhaps one of the most important risk factors. Tinowanzobata prostate cancer muvarume vari over the age of 50. And being of African descent, the black race, we are black men, as you see the panels of 3 black men. And from data from North America, we see that aggressive subtypes of prostate cancer are seen in men of African descent or in black men, making it also an important cancer in Zimbabwe. Then panozoitawo mamwe mafactors akaita sema-genetic factors kana pakamboita a history of prostate cancer in the family in a first degree relative. Those are the major risk factors for prostate cancer.
Okay, thank you very much for that. So should I present because I'm black, or are there any particular signs and symptoms when I should present to hospital? When can I then seek medical attention?
That's an excellent question. Why prostate cancer becomes an important topic to discuss and for men to be aware is because this is a cancer that can be detected early. So in terms of signs and symptoms, we know the natural history. There is actually a long latency period where men are asymptomatic. So that's the time when we actually encourage men to come for screening, because when patients don't have symptoms, they can actually get a test which will even diagnose them before they become symptomatic. By the time they begin to exhibit symptoms of disease, and some of the common symptoms that men present with are symptoms of obstructed urinary flow. We call them obstructive urinary symptoms. Those are the major symptoms of prostate cancer. The local diseases, the urinary tract is obstructed by the tumor. You also have symptoms of disease due to disease spread. They can also present with backache. They can also present with numbness of the lower limbs. Sometimes it affects the sexual function, and erectile dysfunction might be one of those symptoms that men present with. That's why it's also an important disease to discuss because of its impact on sexual function.
Oh, thank you very much, Doc. But maybe sorry to take you maybe a bit back.
Okay, sure.
You talked about screening. Mm-hmm. What are the screening options that are available? Maybe if I may.
Excellent. So in terms of screening, the recommended test is a blood test which we call a prostate-specific antigen. It's abbreviated PSA.
Okay.
So it's a cheap test that can be performed by your usual healthcare provider. Even I'm sure at Corporate 24, that's a test that can be done by clinicians here. We recommend it between the age of 40 to 45 for men who are at high risk of developing prostate cancer. Vaya vatambotaura kuti vanenge vane family history, vakamboita family member akaita prostate cancer. But for those vane standard or average risk of prostate cancer, maybe from the age of 50, that's when we recommend that blood test. And we recommend that it's done annually. And we know November being Men's Month, and when we have a lot of conversations about men's health, I guess that's an important time to advocate for men to have that test.
Okay. Okay. So that's screen the bad tragedy or the suspect that probably there is cancer. Chinola is the way that they can be cured or treated.
Excellent question. Mfunzo wakanakisa chaizvo. Kana munhu achinge aitwa that screening test, for example, taona kuti the PSA is elevated. Usually the normal PSA range is from 0 to 4. And when it's above 4, maybe between 4 and 10, you probably have a 20 to 30% chance of getting prostate cancer, of having it. Then if it's above 10, it's probably over 50% chance that you have prostate cancer. So if you have an abnormal screening test, the next port of call is to refer you for a biopsy that can be done under ultrasound guidance. A sample is sent to the lab to see if they're actually cancer cells. So when a pathologist, chiremba vakadzidzira kuona matissues emuviri, vapa report yekuti pane cancer, that's when we actually say kuti munhu ane cancer, and then they are then referred for treatment. And as oncologists, we manage cancer in a multidisciplinary setting. We work with our close colleagues, the urologists. We also work with the radiologists when we need to do imaging to determine the stage of disease. So by and large, for prostate cancer and other cancers, marapiro atinoita zvinoenda kuti cancer icho iri pastage. So we do those tests, the scans, CT scan, MRI, the different scans that you are aware of that help to establish the stage. So if it's localized, we can give curative treatment. But if the disease is spread to other sites, then the goal of treatment is to control further spread. We may not be able to cure, but we may be able to contain or control the disease. Then in terms of the options for localized disease, prostatectomy, which is surgical removal of the prostate. Then the other alternative would be radiotherapy, which is a treatment yatinoshandisa high energy X-rays in the treatment of cancer. And they are almost equivalent even when you look at the studies looking at those treatments. So when we do the MDT, we counsel the patients on the benefits and risks of the different treatments, then the patients may choose what they prefer to have between surgery, prostatectomy, and radiotherapy.
Okay. Thank you, Doc. But you know us Zimbabweans. Tofanira kushandisa mahebs. Pamaheb baba. Kuti atitopana ere maheb anoshanda. Something that you would recommend. What do you think about that?
Herbs are a very topical subject. I'm sure even chiremba vavarwere vakawanda vanoshandisa maherbs, not only for cancer, prostate cancer, but for zvirwere zvakawanda. And what's unfortunate is that the herbal industry, the alternative medicine industry, is not regulated. Saka people can just munotema mashizha emuti whatever kuti mushonga uyu unorapa zvakati, because there is no regulation of that industry. Saka the greatest challenge is that these herbs have never been tested in clinical trials. Saka we cannot recommend that this herb inogona kubatsira for whatever disease. And one of the goals of the Ministry of Health is to ensure that alternative practitioners vanema mishonga yavanofunga kuti inoshanda. We have many institutions of higher learning in Zimbabwe, University of Zimbabwe, a lot of universities, where these things could be tested for them to be used safely. Because if you are going to use a herb, then that cancer is going to spread, and then you're going to die of cancer, and you end up getting a bad outcome. So our recommendation would be for people to use treatments that have been tried and tested and validated by scientific evidence. But then again, this is a recommendation. People make a choice, but also we recommend what we feel would be best for patients.
Okay, thank you very much, Dr. So in terms of making choices, in terms of seeking treatment, there are quite a number of issues that concerning patients. You mentioned radiotherapy, which people know as Kupiswa, yes, and quite a number of people are actually afraid of that. And I've also met patients saying some of the steps they could treat certain parts of your body. What are some of the myths that are affecting or delaying patients from seeking treatment?
Chiramba ndinokutendai zvakanyanya nekuunza that important point, the perception of treatment. So cancer treatment perception is very poor in Zimbabwe, not only among patients themselves, but even among fellow health practitioners. And mazuva akaita sekuti kupisa, they stigmatize the treatment a lot. Zvekuti kana une your relative, your father, your brother, umuudza unzwa kuti ane prostate cancer, unzi amai nyori kuenda kunopiswa. That term in itself really is stigmatizing the treatment very badly. Saka radiotherapy is a science, and the science of radiotherapy is that it uses X-rays. We know my X-rays are not for diagnosis, but in this instance, X-rays are being used for treatment. The difference being my X-rays, a radiotherapy of a higher energy, so that they kill cancer cells. When a patient goes for a chest X-ray, they don't feel any pain because my X-rays, it's electromagnetic radiation. So we cannot perceive them with our human senses, which is the same as radiotherapy. So you cannot perceive them with your human senses. Such that a lot of patients who go through the radiotherapy process will then tell you, you know, the perception that patients have before they come for the treatment and the experience of going through radiotherapy, it's a life-changing experience, such that I guess for your next podcast, it might be a good idea to have a cancer patient who can actually tell you the experience they went through and the perceptions that they had before the treatment. So that really affects utilization of our treatments, and we hope that if we are able to correct these myths, even as part of the training in the curriculum for nurses and doctors in training, to rotate through the radiotherapy department so that they are also very familiar with the treatments, so that even when I refer my patients, they can also use the right words. Mukenda kurapwa cancer, mucharapwa nema X-ray. Kwete mukenda kunopiswa, because kunopiswa munhu haachambouyi ikoko, when the treatment is actually going to give them outcome yakanaka kuti asafane cancer nekuti asina kuwana radiotherapy. But then we also have a challenge that radiotherapy services have been limited, but it's also something the ministry is working on to ensure that we have consistent radiotherapy services. So we are hopeful that in the coming year, radiotherapy services will be restored. Then mabvunza mubvunzo wekuti pama-treatments aya pane dzimwe nguva yekuti munhu anogona lose a certain organ or an important a surgical procedure, so to speak. So some of the treatments, we just mentioned radiotherapy in surgery treatment options. Prostate cancer inodrive one the male hormone inonzi testosterone, and the testosterone hormone inogadzirwa nema-testicles. So in terms of my approaches to treatment, one of the important approaches for high risk subtypes of prostate cancer, they could deprive the cancer of that hormone of testosterone. So we call that androgen deprivation therapy. There are a number of ways in which it can be implemented. The more expensive one is of injections. These are 3 monthly injections that a patient receives, and the injection costs maybe between $400 and $500 USD. So it's quite expensive. So the more affordable option would be a procedure to remove the testicles. We call that an opiectomy. It's a very uncomfortable even conversation to have with the patient. But when we understand the signs of the cancer, a lot of patients who might otherwise be unable to afford the injection will then have that treatment as part of androgen deprivation therapy.
Okay. Thank you very much. You know, there's one thing that I really liked about this discussion. I also have my talk here was also getting to understand some
of the things.
So that is everything. Yeah. Thank you very much, Doc, for enlightening us and letting us know. If I may just say, we even have lost a lot of people due to maybe that late presentation that we talked about. And like you said, if we can go for screening early, it is something that is treatable and quite manageable.
Definitely, thank you very much. And I think as a parting note to fellow practitioners, they tend to see men for a lot of other issues, hypertension, diabetes, being in the habit of actually routinely screening for prostate cancer for men over the age of 40. If it's actually implemented, we are likely to pick more cases early and we get better outcomes with early detection of disease.
Thank you very much, Doc. Thank you, viewers, for joining us for this episode of Health Matters with Corporate 24. And thank you very much, Dr. Makoa, for such an insightful program, such an insightful discussion. Thank you, Dr. Shibaba, for helping me to unravel this thing called prostate cancer. I'm sure, viewers, you have managed to take a lot of notes whilst we were discussing, so that it's a stitching time saves 9. So thank you very much. Next time.